Important wound care tips for diabetic people. There was a time when a minor cut only needed a quick wash and a bandage, and a mother's magical healing kiss if you were a youngster. But if you have diabetes, a wound, cut or skin abrasion requires much more care and monitoring. In most people who have diabetes, wounds and cuts heal slower than in non-diabetics. Diabetes also increases the chance of an infection in minor wounds and cuts. A small cut can turn into a large and very serious complication. For example, a small injury on the foot can lead to foot ulcers. Diabetic foot ulcers, which are painful sores that can ultimately lead to foot amputation, affect 15% of people with diabetes. Yes, amputation is a real possibility in severe cases. Do not make the mistake of thinking, "That won't happen to me." Several factors play a role in wounds and infections in diabetics. Diabetes can lead to a weakened immune system, which can increase the time needed for healing. When blood glucose remains high, it impairs the functioning of white blood cells, resulting in an inability to fight bacteria. Uncontrolled diabetes is associated with poor circulation. As circulation slows, red blood cells move more slowly, which means it becomes more difficult for the body to deliver nutrients to wounds. As a result, injuries heal slowly, or may not heal at all. Neuropathy or nerve damage, one of the many diabetes side effects, can also make the matters worse. Suffering from minor wounds or cuts can be challenging with diabetes, but you can treat the problem with a little patience and good knowledge regarding what you should do. Here are some important wound care tips for people with diabetes. 1. Clean and check the wound. Before you start any kind of treatment, clean the affected area thoroughly. Proper cleaning of a wound will ensure optimal healing and reduce the risk of infection. The easiest way to clean minor wounds is with clean running water. This will help remove as much dirt, debris and bacteria as possible. 1. Use cool water under moderate pressure and a mild soap to wash the wounded area. If you do not have filtered water, use boiled and cooled water, or distilled water. 2. Gently pat the area dry using a clean towel. 3. Apply a thick coat of any antiseptic cream. 4. Cover it with a sterile dressing or bandage. 5. Change the dressing frequently, at least 2 or 3 times daily. At the same time, no matter how minor a wound is, if you are diabetic you need to check the wound more often. Whenever you remove the bandage, thoroughly check the affected area for any sign of infection. If you notice any abnormalities, address it with your doctor immediately. 2. Manage blood sugar level. To reduce the risk of infection from minor wounds and cuts, it's also important to keep a close eye on your blood sugar level. High levels of glucose in the blood can delay the healing process and even increase the risk of infection. So, when suffering from any kind of wounds, it is imperative to control your blood sugar level. You can do this by eating healthy and diabetic-friendly foods, and incorporating at least 30 minutes of physical activity into your daily routine. Also, do not forget to take your medicines and insulin on time and as directed by your doctor. Check your fasting and postprandial, post-meal, blood sugar levels several times each day, and see your doctor immediately if the levels are high. 3. Honey. Honey can be used to treat wounds in diabetic people. Honey promotes rapid wound healing by stimulating tissue regeneration, angiogenesis and fibroblast growth. Also, the osmotic effect of honey keeps the wound moist and clean, which is important for healing. Plus, the anti-inflammatory action of honey reduces pain and swelling. 1. Clean the affected area with plain water to remove dirt and germs. 2. Rub honey on a wound dressing and carefully wrap it around the affected area. 3. Change the bandage 3 or 4 times a day. 4. Aloe vera. You can use aloe vera to treat wounds in diabetic people. Aloe vera has analgesic, anti-inflammatory and soothing properties. Also, its gel is rich in phytochemicals that can ease pain, reduce inflammation, increase the moisture content in the skin and promote healing. 1. Cut open an aloe vera leaf and extract the gel. 2. Apply this gel on the wound and allow it to dry on its own. 3. Clean the area with warm water and pat it dry with a soft towel. 4. Repeat several times a day until the wound heals completely. 5. Turmeric. Turmeric is a natural antiseptic and antibiotic agent that can be used to heal minor wounds and prevent infection among diabetic people. It is the compound curcumin in turmeric that improves wound healing by modulating collagen and decreasing reactive oxygen species. If a minor wound, cut or abrasion is bleeding, apply some pure and organic turmeric powder directly on the affected area to help stop the bleeding. To promote wound healing, mix 1/2 tablespoon of turmeric powder in enough coconut oil to form a paste. Apply it on the wound 2 or 3 times a day to reduce pain and prevent infection. You can also mix 1 teaspoon of turmeric powder into a glass of hot milk. Drink it daily for a few days before going to bed. 6. Coconut oil. Coconut oil can effectively heal wounds in diabetic people. The oil is effective due to its amazing antibacterial, anti-inflammatory, moisturizing and healing properties. It can even keep infections at bay and prevent scarring. It even helps to deal with the pain and swelling associated with wounds and abrasions. Apply extra virgin coconut oil on the wounded area. Put a bandage over it to seal in the moisture. Reapply the oil and change the bandage 2 or 3 times a day. Use this remedy for several days to prevent scarring. Also, aim to include 1 to 2 tablespoons of extra virgin coconut oil in your daily diet. 7. Olive oil. When it comes to wound healing, olive oil is also very effective. It's rich in omega-3 fatty acids that can actually reduce inflammation, which can help speed up the wound healing stages. Its monounsaturated oleic and palmitoleic acids, in particular, help in wound healing. Include olive oil in your diet by using it in your salads, smoothies or soups.